feel like we are not live. There we go. All right. Now we're up. Happy tea with Dr. D. Technical difficulties, but we got it, I believe. So I hope y'all are doing great. This is Tea with Dr. D. Welcome to the show. We jump on, answer whatever questions that you have about health, about healing. We go through any of the good stuff and make sure that y'all get all the answers that you need in terms of regenerative medicine, any forms of health that you can think of, or any questions that y'all have. I'm here for it. So please drop me a line, say hi. Let me know what questions you have. I'll do my best to get any answers to you that I can. Tonight, I am drinking some Maojian tea. This is our tea of the evening. If you haven't had, this is a Chinese green tea that is really, really good. Very much like a kind of calming and relaxing tea. It's got a really good flavor to it that will help kind of calm you down. Great evening or afternoon tea. So Maojian green tea, no caffeine or anything like that. So very good one. So cheers. And we'll dive in. I know we had a couple of questions. Thank you all for everybody who texted in any of the questions that we have. We do try and go through those as much as we can. I probably get a couple of questions from y'all a week and kind of answer as much as we can. So we will dive in. You can definitely text anything that you need to 801-691-7582, and I'll get to that. That is me who answers those. So if you've got one, that is coming from me. I know we were talking a lot about trigger points over the last few podcast episodes. So if you haven't tuned into the podcast, the Pain and Performance podcast on all platforms, and we got a bunch of questions about trigger points. What do trigger points do? Where do they come from? So we just pulled a few of those. Gabriel said, in essence, so helpful in terms of information about how trigger points can cause pain, and asked the question, could trigger points be causing my shoulder pain? And we got a bunch of questions about, could our trigger points in our shoulder be causing neck pain? So when we're looking at like trigger points and what they do, I'm going to show y'all some pictures. Y'all are going to get caught up on this. If you ever look up these like trigger point manuals, so we can look at like these little like shaded in regions. So your upper trap, this muscle here, when you've got trigger points in there, it can cause a referral pattern up into the head and around the ear almost. And that's one of the things that we see a lot when somebody comes in and this is all tight and we've got trigger points in there. They'll come in saying they have a headache. They've got pain wrapping around the ear, up into the head, around the eye. And one of the mistakes we'll see a lot with that is like somebody treats this like a tension type headache that's just coming from tension in the neck or in the head, when in reality, what they're getting is referral pain from a trigger point. So just knowing where your pain is coming from and how those trigger points can refer pain to other areas gets really valuable for you, because then what you can do with that information is you go after the root cause of where that pain is coming from. And you can actually start to feel when you get on some of these trigger points in the shoulder, how much that radiates into the head and neck. Another thing that is really helpful for our patients to understand is how all this is connected. So when we're looking at trigger points, y'all bear with me. I'm going to try and show y'all something here. Can we do this? So yeah, this is perfect. Okay. So hopefully you can see this. So this is a anatomy trained myofascial line. And so this shows you how the kind of muscle and fascia are connected from the shoulder. This is not labeled correctly. That is not your tricep. So this shows you how the trap is connected to the deltoid in the shoulder, down through the back of the line into your wrist and elbow. So all of this, all the way up into the neck, is all connected by muscle and fascia. And if we develop trigger points and restrictions anywhere in that line, then what happens is all of the structures through the line are now tensed. Everything along that can actually be causing symptoms to move up and down. So if you have a trigger point up in your trap, not your tricep, um, it could be very easily referring pain into the back of the shoulder or even into the forearm, into the wrist extensors, where you feel like you almost had tennis elbow. This is really helpful. What we tell people is, like, if you have pain anywhere on this line, you need to loosen up the tissue all along the line. And what'll happen is you'll find spots in there up and down where you didn't even realize that you were having trigger points and you were having problems in there. So really helpful to kind of see these anatomy train lines and how much all of that is truly connected in there. So when you talk about, could trigger points be causing your shoulder pain? Absolutely. A lot of trigger points in the upper trap will cause referral patterns into the back of the shoulder and down in the arm, and vice versa. We'll see people who have problems in their kind of lateral elbow, and that nerve and fascia getting irritated there will actually track up and cause pain into the shoulder. So very helpful. I would say if you're like rolling out or you're doing anything, target that whole line, look up for this upper extremity anatomy train, and you'll see a bunch of pictures like I just showed you. And it'll be really helpful to hit that whole area, get some way of loosening up everything along that line. So hopefully that helps. I know trigger points are kind of one of these things that we have a lot of questions on, is like, what is a trigger point? How does it affect things? So trigger points are, oh, there you go. Any tips for releasing trigger points? Thank you, Thawanka. Hopefully I pronounced that correctly. So a trigger point is an area in the muscle where the fibers have contracted. So the muscle fibers are staying tight in there. The problem with a trigger point is that it creates what we call an energy crisis. So this energy crisis is where that muscle is so tight that it's restricting blood flow to the structures in there. If our muscles aren't getting blood and oxygen, they continue to create energy, or try to, through the lactic acid pathway. And this starts to create all kind of chemical mediators that don't feel real good if they accumulate in the tissues. So this is why it's so important to get trigger points released, because if they stay there, we continue to produce more and more of these kind of, acidic mediators that cause pain. So what we need to do is loosen the area up in the trigger point so that we can restore blood flow. So now we're getting oxygen in, we're clearing out any kind of chemical mediators, we're cleaning out inflammation, all these good things. So how do you do that? My favorite way to release trigger points is just using like a tune-up ball. If y'all have been in the office or y'all have seen some of my material, we use a lot of these kind of like mobility balls. It's fairly hard, not super hard like a baseball. It's got some give to it. And basically what you'll do is find the trigger point and hold pressure on that. As you do that, you're spreading these muscle fibers out, and the body goes into this little state where it gets nervous. It thinks that it's restricting blood flow and oxygen even more to that tissue. And so it hyperdilates the blood vessels. And as soon as you relieve that pressure, you get this rush of fresh blood and oxygen in there. That's really helpful to release the trigger points and restore blood flow. I do like the percussion guns that many of y'all are using. I think you should use those on stretch a lot of times. So if you've got a trigger point in your upper trap, in your shoulder, you should stretch that tissue out and massage it while you're holding that muscle on stretch. Much more effective than just sitting there and kind of beating up the tissue. Stretch that out, find the exact spot, massage it with the percussion gun, and then you'll see that it kind of starts to release. And if you were getting referral patterns with movement, you'll notice that goes away easier. And then you can use that as a test retest. So like, go back to it. Is it all the way gone? I have a little bit left. Let me go back and massage it some more. Another thing is when you hold pressure on a trigger point. So you have a mobility ball, you're pressing that into these trigger points that you're finding. Take a very deep breath while you hold that pressure on and let all the tension out of your body. Let everything go. Take a deep breath, let everything go. Take a deep breath, let everything go. And you'll notice 3 or 4 of those deep breaths, and a lot of that tension dissipates out of there. You're using your nervous system to tell the muscles to relax while you're holding pressure on it. Very powerful. I know that seems very simple, but the amount of like trigger points and knots that I've been able to get people to let go on their own without having to go to a doctor or anything, just by learning how to get a mobility ball, find that spot, put deep pressure into it, put it on a little bit of tension, and just let all the tension out of your body and breathe that trigger point away. It can be very, very powerful. It can really help a lot. So those would be my favorite couple is get a mobility ball. We use tune-up ball. If you look that up, if you're listening or watching this from abroad, they make some really good ones. They have a really good tension to them. So find that, get on there, and start doing some breathing while you hold that and work through that. Do it a few days in a row. Don't cause any soreness or bruising with it. And you'll notice really good improvements in mobility, and those trigger points will start to melt away. Obviously, if that doesn't work for you, medical dry needling is the most powerful way I've ever seen to release a chronic trigger point. Get under a really good practitioner who knows how to do some trigger point needling and can reset the problem there. Why are you getting that trigger point is a question we ask in our office. Is that coming from your body trying to protect you for some reason? Or is it just a trigger point that's gone chronic because it's not getting blood flow? So if you have something and you've tried to roll that out and it's not working, give us a call. Usually if it's a minor trigger point, a couple of sessions at the very most will resolve a trigger point. You'll feel all those releases and stuff, and you'll feel that blood flow. I mean, right after the treatment, a lot of our patients can attest to that. So hopefully that helps. Thank you for the question, Thuanka. And Simon, can you go deeper into fascia health? Fascia, one of my favorite podcast episodes. If you look up the episode with Julia Blackwell on the Pain and Performance podcast, really good overview of what fascia is, how dynamic fascia is. So fascia is the covering of your muscle. So our muscles all run through our body, and there are all these little muscle fibers and spindles. But if those weren't covered and organized, we would have problems. We would have everything kind of moving all over the place. So in our body's infinitely wisdom design, we have coverings of these muscles. So the muscles are covered by fascia. And then even between groups of muscles, there's fascia. It's very, very good to help everything move and slide very well. The problem with that is some of these areas get restricted where the muscle's not restricted, but the fascia is not stretching and giving the way that it should. And we're learning more and more about how fascia actually is this communication highway through the body. So even on top of, if I show you my little picture again, even on top of the fact that I'm going to show you all the superficial backline. So this is a myofascial anatomy train. So muscle and fascia connecting all the way through the body. So if we look at something like this, you can see how the fascia, from your head at the base of your skull, connects all the way down through the back, all the way down through the hips, the hamstrings, the calves, all the way down through the ankle into the plantar fascia of your foot. So this is a myofascial train, and it groups together and connects all of these muscle and fascial structures all the way through. Now, what we've learned lately is that the fascia here can actually communicate tension and changes up and down this whole structure. So that's really, really helpful, because now what we can say is, like, if I change my fascia here, it actually communicates down my back into my hips and my hamstring that, hey, I'm relaxed up here. Y'all can follow suit. So there's a communication that we're just starting to learn about when it comes to fascia. So That's a big part of it. Another thing, whenever you're looking at fascia, is that you have to get it to glide and slide better. Going back to the trigger point thing, I think medical dry needling is fantastic when it comes to getting rid of a trigger point. If a trigger point has been there for a while and we've had restricted blood flow around that, and we've started to create some of these inflammatory mediators, what will happen is all the structures around that will start to get really stuck together, and they're not moving very well because of the inflammation. This is where doing something like active release or hands-on or very deep tissue massage, muscle scraping, and even doing some trigger point release like we were talking about with the ball can really come in very handy to get the fascia gliding better. When fascia sticks together and you're trying to move or turn your head or bend over, and the fascia between the muscles of your back and your let's say the muscles of your back and your hip where they cross, if those fascias are not gliding well together, you'll get restrictions. When you get restrictions, your muscles want to stop you from moving, so they tighten up, further going back into that restricted blood flow. And that starts to really kind of set off this bad momentum where my muscles are tightening, so I'm not getting blood flow. Because I'm not getting blood flow, I'm getting inflammation. The more inflammation I get, the more my fascia starts to get restricted. So I tighten up even more. And this little pathway gets stuck. We see this all the time where a minor injury, had it gotten addressed earlier, would have been completely resolved. But now that we've let this energy crisis stick around, now all of my muscles are on spasm, my fascia is not moving real well, and I'm having a lot of trouble getting rid of my pain. So when you look at fascia, I think there's a big part of it. It protects and covers our muscles, supplies a lot of nutrients to the tissues around that, and it helps to glide the tissues in our body. So if you're having fascia trouble, you really want to work a lot on kind of actively releasing those structures in there. Get with a really good therapist who does some active release. And it's going to hurt. It's going to be sore because you're pinning that muscle down and you're trying to almost kind of loosen the adhesions between the fascial layers. It works incredibly well. I would say if you pair that active release with dry needling, that is going to be the most powerful treatment for a myofascial trigger point that has caused some fascial restriction. So fascia runs throughout the body. It's all kind of connected. I think our little song of the bones needs to be updated, where we're talking more about the fascia being connected than the knee bone and the hip bone. But, it was probably helpful when we were young, right? So hopefully that helps, Simon. I would definitely check out. We have a lot of information on fascia. But if you're having trouble with it, get some hands-on care. I think fascia really needs somebody to be kind of helping you release it. It's really hard to do it on your own, but possible if you like to inflict self-inflicted pain. So hey guys, thank y'all for chiming in. I see a bunch of y'all kind of jumping in and dropping some likes. Thank y'all for jumping on with T and joining us, hopefully with an early dinner. This would be a good little dinner and a show, dinner and a tea with Dr. D. Let's keep on rolling. So Cami Lamique, we'll go with that. Thank you for the question. I've heard laser's great for inflammation. Does it hurt? How many sessions do you need? Yes, I do agree. Laser is really good for inflammation. So to catch a lot of you up, so we use something called a high intensity laser, and we've put quite a bit of kind of information out there and like before and after and how much that can help the healing process. So when you're looking at what laser does, so laser uses a high intensity photobiomodulation, high intensity laser. Ours is over 1,000 nanometers is like the wavelength of the laser. When that goes into the tissues, all of our tissues have a little photoreceptor on it. And when that photoreceptor gets excited, it increases the energy the mitochondria can produce. So what does that mean? All of our cells produce more energy whenever we use a high intensity laser. So anything our cells are trying to do, they can do it a lot better. Up to 7 times more energy can be produced when you stimulate cells with a high intensity laser. So that means if our cells are trying to clear out inflammation, they can do it up to 7 times better. If they're trying to repair and rebuild tissue in our regenerative therapy programs, it helps them do it up to 7 times better. So this is what laser does. If we have inflammation in an area, it just supercharges those cells so they can clear it out. So I've seen young athletes come in with a very swollen, sprained ankle, and we do a full laser session and not even touch the ankle, didn't push any of the fluid out or anything. And that swelling is 50 or 60% down in a matter of 10 or 15 minutes of doing a laser session on it. So it's really good to clear out inflammation, especially if we catch something acute. So we had a patient who found out that they had an injury to one of the vertebrae in their neck, very swollen around the neck, come in, laser up and down those vertebrae where that injury is at, and almost all the inflammation is gone after a single session. Now, we need to go in and heal that, and laser's great at helping the tissues repair. We use it a lot to get increased energy so the cells can actually rebuild themselves. Very powerful for that. So it does help with inflammation, among other things. Anything our cells are trying to do, it's going to help them do it better. Does it hurt? I don't think so. I think if you do laser correctly, you feel a good deep heat because those cells are producing so much more energy. I don't think that there's pain with it. It's hot. Like for me, it feels like a sun is shining into your tissues. I know that sounds weird, but that's what it feels like to me. It's very deep and penetrating, which is the good thing. Our laser goes 5.5 inches into the body, so it gets really deep to all the structures, and it feels warm. I don't think there's pain with it. I think if you have an active pain area, anything that stimulates that might be a little uncomfortable. So maybe you would feel that, but the laser itself is not painful. So very, very good. How many sessions? Look, if we catch something acute, I would say that you're probably talking about 1 to 4 sessions. If something's, somebody sprains an ankle and it's a mild ankle injury, we do 1 to 4 sessions. Those cells are going to repair. They're going to clear inflammation out. Somebody's going to be running within a short period of time. For a more chronic injury where your body has to rebuild a lot of tissue, look, you might be talking about doing a form of consistent laser treatment to get the body into that regenerative therapy for, anywhere from, let's say, 4 weeks up to maybe 12 weeks for a really intense injury where your body has a lot of tissue it needs to rebuild. A nerve injury would fall in that. If you need to rebuild nerve tissue, that's slow. But doing laser to that speeds it up a lot, whereas it might take 1.5 years to rebuild that nerve. You might be able to get it done in a few months. Laser can really speed some of those things up. So for chronic injuries, we will often tell people, look, plan on doing probably 6 weeks of it for something that's chronic and your body has a lot of work to do. But for acute injuries, the faster we catch it, it can be quite incredible on an acute, like tennis elbow, neck, muscle injuries, tendon injuries. If we catch them right away, high intensity laser can be incredibly powerful. It doesn't cease to amaze me. So hopefully that helps. Is it safe to use on sensitive skin? Yes. Yeah. We probably would change the settings on it a little bit and work somebody up. But same thing, we see it really does stimulate a lot of healing at the skin surface. So in terms of like skin injuries, wound care helps tremendously to help those wounds heal. There's been a lot of studies on it with like eczema and psoriasis, where it helps to heal those plaques. So it can be used on sensitive skin, something that we would start probably slow with and start at a slightly lower intensity to build up. But yeah, thanks. Very, very helpful for those people who have like scar tissue and stuff like that that's sensitive. That's probably one of the first places we start because it is easy on sensitive skin in terms of like causing pain. So hopefully that helps a little bit here. Oh, well, thank you, Connie. I hope you're doing fantastic. We are only as good as our patients and team, and we have the absolute best team here at Acadiana Pain, and we have the best patients in the world. I promise that is the truth. Uh, let's see. I'm going to jump onto a quick question that we got from Instagram. So, constant progression. I'm healing from a muscle tear in my vastus lateralis. So, in the quad 6-7 weeks ago, would dry needling help the healing process? So, for a muscle tear like that, what I would do is absolutely continue to stimulate healing with dry needling. Once you have the muscle injury, your body's going to start a healing process there. But we do want to continue your body going through that repair process. So continuing to make sure that there are none of these like trigger points developing as the muscle tries to heal, and following the pathway of the muscle so that scar tissue doesn't get too heavily kind of intertwined in those new healing segments in the vastus lateralis. There's a supplement called Wobenzyme that I would add in. Wobenzyme is a proteolytic enzyme that helps your body to prevent the laydown of excess scar tissue. You need to heal that vastus lateralis, but you don't want it to be all scar tissue. You want it to be flexible, healthy tissue, and that'll help a lot with that. Honestly, if I was looking at like, hey, I'm going to do everything I can for this, what we would do is we would do some stimulating dry needling along that pathway. It probably wouldn't be terribly deep unless we find some trigger points in there. And we would stimulate that to get blood flow in there. I would probably use a peptide. We would look at doing like a BPC 157 at 500 micrograms. Take it in the morning on an empty stomach if you can. And then we would add high intensity laser on top of that so that those cells, again, have the energy to complete the repair process. And doing that, you would probably have 6 weeks of repair. We would look at it under an ultrasound. How much is it rebuilding? And then you need to start loading it. But I wouldn't start that process a whole lot until after that, like 6 to 8 weeks, so that that tissue is healing. And then we can start stressing it and start rebuilding it. But hopefully that makes some sense to you of how to go about that. Dry needling alone would be of some help for sure. You're going to keep blood flow in there. You're going to continue healing. You're going to keep inflammation out of there and get rid of trigger points as they develop, break up some scar tissue. But I think you could do even more if you add like a full regenerative therapy program. But if nothing else, get some Wobenzyme. It'll help you kind of keep ironing out any of the scar tissue in there as you kind of go through the healing process. So hope that helps. I hope that makes a little bit of sense to you. Thanks for the question. Constant progression coaching. All right. What else we got? Thank you. This is a good one. Very good. I'll let y'all get back to your evening, but thank you all for the questions. We're here for you at any time. If you need anything from healing, regenerative therapy, laser therapy, cryotherapy, hit us up. We're here to help out any way that we can. You can go to acadianapain.com. And we have a lot of information we're working on, kind of continuing to put a lot more of that out. Make sure you check out the Pain and Performance podcast. There's a lot of this information on there. We try and put out, bring somebody great on as much as we can. And you can always text me, 801-691-7582. I try to answer those as fast as possible if I can. That for me, if you know me, as fast as possible might be like 2 or 3 days. I'm not the best texter, but I will get to it. I promise you. So I hope y'all have a great evening. Remember to do like one thing to get a little bit healthier today, tomorrow. That can be drink a little bit of water. Sharon, thank you so much, my dear. I hope you're doing fantastic over there and having a good, nutritious dinner. But thank you all. Have a great evening, and I will see you soon.